Hi, I'm Jace. For those of you who don't know me, I'm 17 and I live in Southern California. And if you couldn't tell by the title of this video, I'm transgender. Yeah, and I'm what most people refer to as FTM, female to male. I just use the term trans guy or guy, not a big deal to me. But today, a big step in my transition, I started hormone replacement therapy and I got my first shot of testosterone. So I want to talk about my dosage, the other things I'm taking. I'm taking estrogen blockers, and what the actual injection was like. So I'm going to start off with my testosterone prescription. I'll show you the little vial. I'm not sure what the camera is here. Okay, cool. Yeah, so I'm doing intramuscular injections. My dose is at 50 milligrams, and that's 0.25 milliliters, and milliliters is what you actually measure, like, on the syringe. Yeah, so that's just my starting dose. They always start you off low, just so that your body has time to adjust. Yeah, sorry, I was trying to make, I tried this video 2 other times on my computer. I'm on my phone right now, and they both just didn't work. So, I'm really tired right now. I'm really spacey. I just spent an hour trying to fix those, and it didn't happen. Yeah, so that's my dose. It came in this package. This little flap over here is my actual prescription, my information. Ooh. And then inside the package, there's this folded up piece of paper. If you unfold it, it shows you, like, the chemical makeup of what's in your testosterone, and also all the, like, warnings. I would say it's important to read those, but you should have gone over most of them with your doctor beforehand. And for the record, I'm seeing Dr. Angela Miller. I'm not seeing her, she's not my personal doctor, but she's the head of the group at Orange County Research Center, I think it's called, in Aliso Viejo, and she has had other trans patients. So I'm working with Dr. Ashley Mullen, I think her last name is Mullen, there. I like her a lot, and they've had other trans patients, so I trust them and that they know what they're doing. Oh yeah, and the bottle, the testosterone bottle, it has in it 200 milligrams per milliliter. And I'm not self-injecting yet. But the reason I have this with me already is because I went in there Friday. It's Monday now. Just if anyone's watching this later. I went in there Friday to get my first shot, and they ended up having the wrong kind of testosterone there. So they told me, just go pick up your prescription. It'll actually be cheaper than using ours when you do it here. Apparently that costs like $100. They have some sort of fee, whereas this little bottle costs $15, and them doing the shot, they have a fee for shots, and that's, I think it was about for $35. So more expensive than the actual tea. And on my next visit there, they're gonna teach me how to self-inject. Hopefully, that's what they told me today. So they also prescribed a few other things. They gave me estrogen blockers, which I'm going to be taking at the same time that I'm on tea. I did get to start them Friday, so a few days before getting my actual shot. I'm on 2 different kinds, and they didn't explain fully, why I need to be on them, because I know most trans guys who start testosterone, they don't use estrogen blockers. Especially not at the same time. But I'm hoping that, it'll help my body not have to, choose so much between them, have a little, war within itself, so it'll help, warp. So it'll help, the changes come maybe a little bit faster, maybe, please. And, also, if I have, sometimes your body can convert extra testosterone into estrogen. Hopefully it'll prevent that. Also can help prevent cancer, which I'll explain a little bit more when I talk about my second estrogen blocker. So the first one they gave me, which I picked up at the office, and it's called OCMG. It's Estro Balance. It's a dietary supplement, 30 capsules in here. The main component in this is DIM. I'm not pronouncing the actual chemical name, just the acronym. I'm not going to attempt that, just embarrass myself. And they look like this. I take one a day. Super easy, just like normal pill. Vegetarian capsule, which is nice. I'm vegetarian, and I'd feel really guilty if I had to have a gelatin capsule. And the second prescription, this one I picked up at that office, and then this one I had to go to a pharmacy to get. There you go. Sorry if it's backwards or anything in there. And this one's called anastrozole. Tablets, and I take half of one of these, and they're tiny. I don't have a pill cutter, so I just use like a sharp knife. I take half of this a day. And this is the one that helps prevent against cancer. Oh shoot, am I showing my name? Kinda. Oh, whatever. So that's my birth name on here. For the record, my YouTube name says, I think it says Lee Rosenthal, but I go by Jace. Lee is my middle name. Yes, this prevents against cancer, and cancerous tumors. It can actually decrease the size of tumors, which my doctor explained, is because certain tumors are fed by estrogen. And so taking these estrogen blockers is gonna, reduce the risk of cancer, which is good because, testosterone can increase that risk of, like, female reproductive cancer, and cancer also runs really strongly on my dad's side. So I definitely feel good about taking those. Yeah, and so the actual injection I got today, I got it about 3:30 or so. I think I said it's dang it! See, it's late. Intramuscular. I'll show you where. They always say it's like, oh, it's on your butt, but it's not. It's not really on your butt. It's right here. It's kind of like on your lower back fat. And yeah, the nurse was super good about it. She was like in and out 2 seconds. Yeah, it did hurt, like, a little bit, but, like, getting a shot, just, you feel like a little pinprick, and that's it. Did bleed a little bit, but I'm not getting any swelling, the muscle's not sore at all. My mom was like, oh, you should rub, arnica on it, but I feel fine. My friend asked me if I was excited, and I kind of had more of, like, a wow moment when I took the first estrogen blocker Friday. I was like, wow, this is, like, really big step in my life. And I think that, I spent, like, this whole weekend being, like, super stoked about getting my shot. I spent today, so, like, when I actually got it, I was just like, meh. Especially, because you, like, don't notice changes for, like, the first few weeks, and so, it's like, man, I feel same old, but it is, like, amazing to think about that I will start experiencing changes, and I think when I do, I'll be like, wow, this is crazy, oh, wow. So, yeah, I'm excited for that. I feel like leaving things out, but then again, this is my third time trying to do this. Yeah, if you guys just want to leave, like, questions, comments, I'm gonna try to put my Tumblr in the description, so you can leave asks there, or you can just leave comments in the little doobly-dab. Yeah, feel free to ask. I'm pretty open about things. Don't be shy, be respectful. And I'm gonna go sleep. Actually, I have homework to do. Yeah, a lot of homework. Fun. Alright. Bye for now.